Hi, my name is James Gower and I work at Soul Machines, an autonomous animation company with its very origins out of New Zealand and the University of Auckland. And today I wanted to talk about enhancing healthcare experiences with a digital workforce. Soul Machines spun out of the University of Auckland just over 5 years ago, following years of research conducted by our CEO, Dr. Mark Sagar, in the Bioengineering Institute's Laboratory for Animate Technologies. As an organisation, we've grown significantly over the last 5 years. We're now well over 200 employees across the globe, with a large team here in Auckland, mainly focused on research and development and continuing to push the boundaries of artificial general intelligence research. And with a growing team across the globe, as a company, we're now backed by some of the leading AI venture capital funds in the world, all supporting our mission to create, enable, and democratize a platform of astonishing, lifelike AI technology that animates and enriches personal experience. So through our research and development and Human OS platform, we have created an astonishing digital workforce that people can identify with and has applications in a huge range of areas and industries across the globe. And one of those industries is the healthcare industry. So to get started, I thought it would be helpful to position how artificial intelligence, AI as a whole, and manifested in various technologies can help transform how healthcare is delivered. To help here, McKinsey's got a lot of great thought leadership in this space, and it's sort of summarized as such. So artificial intelligence, has the potential to transform how healthcare is delivered. It can support improvements in care outcomes, patient experience, and access to healthcare services. It can increase productivity and the efficiency of care delivery and allow healthcare systems to provide more and better care to more people. AI can help improve the experience of healthcare practitioners, enabling them to spend more time in direct patient care and reducing burnout. So with that in mind, what are some of the challenges in the healthcare industry, and what sort of transformation is already taking place? We've seen a huge shift to digital in recent years, largely accelerated by COVID in the last 18 months. For us here in New Zealand, right now in November 2021, we're still in the thick of the various interventions put in place to reduce the impacts of COVID, which is continuing to create new challenges for every organization. Pretty much every organization needs to have some sort of digital presence or new and emerging technology incorporated into their operating model. This is in order to meet these challenges and still be sustainable in the future. Healthcare especially has had a big transformation. Telehealth is becoming the new normal, 1,500% increase in virtual care. McKinsey's research shows 47% of all patients actually want to continue using telehealth services even after the pandemic. And from their research, 76% of people are actually interested in using telehealth services. So there's still a gap that needs to sort of be provided for as patients and consumers are shifting what they're looking for in their healthcare. Patients and clinicians want more, and now all of us are more open to using telehealth services than previously. If you think about Zoom meetings and video calling, we are now vastly more open to that than before the pandemic. It's become a normal way of providing services and conducting business. With AI, this can allow healthcare systems and healthcare delivery, being able to deliver it more and better care to more people. McKinsey's also, outlined that, up to 250 billion of current US healthcare spend could potentially be virtualized. So one of the other primary challenges across the globe right now is the shortage of healthcare workers. As we know, for those of us in New Zealand right now, we have a healthcare system that is under stress, limits on both general and intensive care units, which have translated into elements of our COVID response. mainly to sort of help support and maintain the healthcare system. I was living in London in 2020 when the National Health Service, NHS, stood up a emergency hospital in the Excel Centre in East London called NHS Nightingale. And, one of the biggest challenges they had there was staffing, a shortage of healthcare workers. The WHO, believes that there's going to be a shortage of up to 10 million healthcare workers by 2030. AI, however, has the potential to help revolutionize healthcare, and help address some of these challenges. Accenture's, they're predicting that AI can help cover 20% of unmet clinical needs and clinical demand, while saving healthcare systems up to 150 billion a year. So unless healthcare organizations start looking to technologies and artificial intelligence to revolutionize or enhance the way they deliver healthcare, it's going to be an ongoing struggle and difficult to remain sustainable. So another issue that is starting to get more attention now is the mental health crisis across the world. 1 in 5 US adults live with a mental illness, it's 50 million people. 1 in 4 New Zealand adults experience poor mental well-being on the WHO's 5 scale. And this in New Zealand was data from 2018, so pre-pandemic. So the indications are that this is only sort of getting worse. And furthermore, the WHO is saying, over 1 million people are dying prematurely from mental health struggles globally. It's becoming one of the sort of costliest conditions, and yet globally, less than 1% of government expenditure goes towards it. So focusing on this, focusing on the expenditure side on solving it, has a massive impact. The WHO has outlined that for every dollar invested in scaling up treatment for common mental illnesses such as depression and anxiety, can lead to a $4 return in better health and ability to work. So what does AI offer mental health treatment? It offers accessibility and responsiveness by being up to date, engaging, multilingual. It allows for privacy. Artificial intelligence, it's impartial, it doesn't cast judgment, and it minimizes risk by reducing physical interactions. It's convenient, available 24/7, infinitely scalable, at an economic scale, that's not comparable. It's much lower cost. And finally, it provides empathy and understanding in what would traditionally be quite a sterile digital experience. It provides for, enhanced cognitive experience, a one-to-one conversation, and personalized care with every single individual. So, where do soul machines come into this? How are we helping solve these challenges now and into the future? And what I'd like to start with, I'd like to show you a short video, that outlines our philosophy as it relates to AI. And so you can see some of our technology in action for the various organizations around the world.
Hi there. I'm Sam, your guide to soul machines. How are you doing?
Soul Machines is an autonomous animation company that has built the world's first digital brain. It enables human-like face-to-face interactions that are personal, empathetic, and interactive in exactly the same way that our human brain animates us and brings us to life when we interact with each other.
So what's important about this human operating system is it providing a connection between artificial intelligence and people, but even more importantly, it's creating this connection between people and artificial intelligence. So as we explore the potential for this, people can put this technology to work in a way that redefines their business, redefines what is possible for their customers, for their clients, for their industry. And we're moving into an era where we're going to spend more and more of our time interacting with artificial intelligence, with robots and other forms of automated machinery. And the core concept behind what we do and the technology we deliver is, wouldn't all of those machines be more useful to us as humans if they were more like us? Literally, Soul Machines puts a face on artificial intelligence. I mean, it adds the human qualities of emotional intelligence to the AI systems, and it means we can interact with artificial intelligence in an incredibly human-like way.
Soul Machines digital people provide a safe and engaging way to connect brands and customers. We are creating mind-blowing experiences like Nestle's Cookie Coach, Bull's Skincare Advisor, WHO's Florence Healthcare Expert, and entertainment twins like will.i.am and more. Soul Machines digital people are helping companies all over the world and in multiple industries. Soul Machines' autonomous animation is continually evolving to include more complex interactions with content and the world around us. Soul Machines, astonishing digital people.
So, we believe that the digital channels and machines we are increasingly engaging with are going to be far more useful to us if they're like us. So the first part of what makes a digital person is hyper-realistic computer-generated imagery, so CGI. So we create incredibly realistic digital people, right down to seeing your reflection in the lens of their eyes, the same way you would sitting across from someone while having a coffee. They're diverse and representative of all the people around the world. So pairing this with the core part of our technology, the digital brain, a biologically inspired brain that takes input and responds in the same way our human brain does. This allows our digital people to autonomously animate themselves much the same way we as humans do. No coding or puppeting is required. It all happens completely autonomously, exactly the same way I'm autonomously animating myself now. So if you smile at them, they'll smile back. If you look concerned, they will show concern and empathy. And this creates a level of emotional intelligence that just wasn't possible before in a digital channel. And when you start pairing that with cloud platforms, increasingly fast internet access across the globe, and increasing levels of digital accessibility, you have a digital platform that can scale and be accessible to many more people. So what can a digital person do? So digital people, they comprehend speech and human emotions. Given a context of the conversation, they deliver emotionally appropriate responses in real time. So if you think about mental health scenarios, they can be appropriately trained to react accordingly, much the same way as we would train someone to work in those sort of situations. They see you through the camera, the digital brain perceives your facial expressions and your mannerisms. They hear you, multilingual accents, different dialects. They understand and react to different tones and enunciations. They feel the touch. So if they're working through a touch screen, they'll react to the touch of someone touching certain elements of the touch screen and touch elements within their sort of virtual world as well. Importantly, they also think. So they imagine potential outcomes, weigh the criteria, and make decisions about what to do next in terms of how they respond from both verbal, their expressions, and also their gestures. And they're also learning. So through every interaction, through the user inputs from both the people they talk to and the organizations and people they work for and represent, they build their knowledge autonomously from every experience. And they communicate. Gaze, facial expressions, emotions such as attentiveness, thoughtfulness, optimism, curiosity, the whole range of human emotions. And the important sort of side of it is they're able to react. So virtual muscles within their face and now their sort of bodies, they can react in their virtual world, gesture, touch, and bring body language into the whole experience. So digital people, they're allowing us to take existing tools and technology to the next level, all the while retaining empathy and emotional connections in digital interactions with patients. We believe a model that emulates humans is most likely to provide the kind of transparency that real people do when they explain their actions. Connecting with users where they are, inspiring and treating with healthcare expertise, information and guidance, all with thoughtfulness and empathy. Creating highly personalized experiences. So every conversation is a medical grade conversation delivered with empathy and a judgment-free environment, in a conversation that is completely personalized to that individual. And providing this, infinitely at scale, multilingual, multiple languages, and giving the ability to extend knowledge and healthcare to a larger number of people than was ever possible before. So where are we seeing how digital people can impact healthcare? I guess first of all, it's sort of in promoting self-care and wellness. With mental health on the rise, the focus on prevention and wellness with proactive coaching. If we think about sort of self-triage and self-scheduling, being able to reduce clinician and staff time spent on doing these sort of administrative activities. So this improves clinicians' experience where they're more focused on patient care rather than admin. And overall, reducing the cost of care, so providing hospitals with more cost-efficient tools to deliver their healthcare at scale. Also accelerating access to treatment. Patients can quickly have access to a caring resource that can help with treatment before, during, or after a hospital or GP visit. And overall, this is really about supporting true population health, so helping to deliver care to more people 24/7 in multiple languages. One of the other benefits I've talked a little bit about is that they create a safe space. External research and our own internal experiences have shown that people are more willing to disclose to an artificial human, digital person. There's no judgment from a digital person. They will sit there and attentively listen, speak with you slowly to ensure they understand and comprehend what you're saying. And all of this is completely free from any human biases. There's also research that shows that, as a topic becomes more sensitive to the individual, their preference to interact with a digital person rises. So this creates a whole new level of healthcare accessibility that, again, just wasn't possible before. So coming to some of our digital people out of work in the healthcare industry already. Florence was one of our digital people we launched in partnership with the WHO, a multilingual digital healthcare worker who provides true sources of information about tobacco usage and increased COVID-19 risks to help influence smokers to quit. For us, this was the opportunity to help change the lives of over 1 billion people. In Australia and New Zealand, we have relatively mature quit smoking programs. So building this into a multilingual, scalable digital person democratizes the support to so many more people. So now I just wanted to show a sort of short video of an interaction with Florence.
Hello.
Hi, I'm Florence from the World Health Organization. I want to talk to you about the harms of using tobacco, including smoking, and how to quit.
Why should I quit smoking?
It's more important than ever to quit during this ongoing COVID-19 pandemic. Smokers are more likely to develop a severe case of COVID-19.
Well, I want to quit, but I've tried before and it's just really hard.
I'm here to help. I can teach you proven techniques to help you quit, tell you why quitting is a good idea, and more. What would you like to talk about?
Well, how do I quit?
Congratulations. Being motivated to quit is the first step. The best way to quit is to build a plan. Are you ready to get started?
So, there's an example of one other sort of digital people we've created. So moving on to some of the other, digital healthcare workforce, Soul Machines created Bella, we called it Bella Helps during the beginning of the pandemic last year. And Bella was created using kindness research. So giving the ability to provide a digital companion that supports people building personal resilience and enhancing mental well-being. And this was launched on a Soul Machines website, and we had a huge amount of interaction with it early in the pandemic. And this again was about democratizing this sort of support to more and more people. We've also developed a sexual health diagnostic nurse for a large hospital, speaking to a digital person, again, in a safe space, judgment-free environment. She'll help diagnose an STI and ensure the patient seeks the sort of right treatment. We're also developing a digital play specialist for a children's hospital. So the human play specialists are available at limited times to support children with their various techniques during hospital procedures, such as during an IV insertion. So they've got various ways to distract the child, but also the parents and the adults in the room from their sort of indirect anxiety that does go onto the child. So leveraging their techniques and knowledge, the digital play specialists will allow children to receive the support no matter the time of day. So helping reduce this anxiety and concern before, during, and after all these sort of procedures. Another digital person we've created is a Healthline advisor. So this is using 30 years of clinician to patient data advice, using that to build into a conversational AI, then allows this digital advisor to answer multiple health advice and information queries at once for cents on the dollar, all the while delivering human-like empathy and emotional intelligence into these challenging conversations. And finally, working in the field of alcohol reduction support. So we've got an alcohol reduction educator to help people stick to their reduction goals by being available 24/7 and raising awareness of the health risks of too much alcohol consumption, while also helping them put a plan together to reduce this. Again, democratizing that sort of support into sort of a digital environment. So bringing a lot of all this together, I wanted to sort of share a video of our vision on what the future of telehealth could look like. Soul machines and our digital people are a component of all this amazing technology enhancing healthcare and patient experiences. But we help sort of bring this together into a channel that is usable to us while maintaining empathy in these interactions and providing for a diverse, multicultural digital workforce that is scalable and available 24/7.
Hello, this is Soul, Dr. Beanie's assistant.
Hello, Soul. This is Tyler. I wanted to ask you about my recent surgery.
Hey, Tyler. I see that you had a total knee replacement 5 days ago with Dr. Beanie. I have access to your records and can help you with any questions you may have.
Thank you, Soul. First, I don't remember what they found at surgery. I was a little out of it.
No worries. I just read your operative report and reviewed the visual records from the operating room. You had exposed bone on both sides of the joint and a torn meniscus. These are both considered excellent indications for surgery, so you can expect very good resolution of your symptoms.
That's great. The live XR was kind of cool. So, I'm glad it was correct. Also, the drone delivery with my medications arrived just as I got home, but I can't remember which pills to take or when. Can you tell me?
Yes, of course. The discharge summary states that you should take the pain medicine about 20 minutes before you put on your headset for your virtual reality meditation therapy.
And my leg, it's a little swollen as well. Should I be concerned?
First, let's run a thermal scan.
You have my permission.
Thank you. Voice print activation enabled. According to the scan, the skin surface temperature and tensile grade is not suggestive of any complication of a clot in your leg.
Okay, well that's super helpful, Soul. I feel much better.
Yes, I can see and hear that. Your anxiety measures dropped 7 points.
That's so cool how you can just see that. What else did you find?
You were a little behind on your knee flexion goals compared to other people your age and gender at this time in their recovery. You only achieved 100 degrees of knee flexion and are not putting enough weight on your operated leg.
Well, what do you think I should do about that?
I will send your results to Dr. Beanie's office, as you might benefit from in-person physical therapy. I can arrange an automated insurance approval for the treatment.
Okay, well that makes sense. You have my permission. In the meantime, what should I do for exercise?
Voice print activation enabled. I sent the referral request and it was approved. We can review the exercises you should be doing, and if you can put on your rehab sensor shoes, I can help verbally guide your exercises.
Well, I like the idea, Sol, but can we do it a little later?
Of course, I'll reach out at 7 a.m. tomorrow morning.
You're kidding me, right? I'm supposed to be resting, remember?
Okay, fine. How does 9 o'clock sound?
That's much better.
Great. I scanned your home and see that you have a connected coffee maker. I'll set coffee to brew at 8:45.
Well, thank you.
So hopefully that got you excited about what the potential is for the future of healthcare and how AI, digital people, and all these other amazing technologies can come together and improve the lives of all of us through better healthcare services. Thank you.
Hi, James. Thanks for joining us. Thanks very much for that presentation. Great to see some relevant experience in the healthcare sector in particular and in some very topical areas. There was a comment that I wanted to share that came through on the live stream. That was, it's awesome to see the diversity and progress that Soul Machines has gone through over the last few years. Amazing detail. So a nice bit of feedback there from the audience.
Yeah, thank you.
So a few questions. Let me start off by something similar to the question that I asked earlier. How does Soul Machines find and support technical talent in New Zealand? And what are your views on attracting future generations through STEM subjects?
Yeah, good question. So, I mean, Soul Machines we've got a pretty big team now, you know, grown out of University of Auckland. So we have a lot of students in New Zealand that have come across all the universities. I mean, Soul Machines in particular, we run a summer internship scheme, and being the business that we are, we've got the deep AI research function, and then also the sort of commercial side of the business. So we bring interns in business roles, product roles, research and development roles, you know, very diverse team in terms of computer science, engineering, psychology, neuroscience research, even down to sort of audio and voice technicians. It's a very diverse sort of team of people. I guess the way we sort of, you know, the way we approach people as well is, you know, working in a startup is it's a sort of challenging environment, but everyone's ideas are heard, and it's always the best idea wins, no matter where it comes from. You know, we sort of always want to build a culture of continuous development, culture of innovation and openness. So we're always sort of working towards that, and a lot of that's coming through the sort of internship schemes. And I think where things are also shifting now is, I mean, I graduated probably 6-7 years ago now. There wasn't a company like sort of Soul Machines out there doing this sort of diverse range of work, and particularly in New Zealand, there were very few technology companies available. So that's continuing to grow. I think from a investment perspective, the more well, across the world, but also in New Zealand, the more investment and capital investment that goes into ideas and companies is going to help attract people into those studies and into those areas.
Okay, that sort of runs into a question about other companies working in the same space as you. So the comment that there's other companies such as Unique working on AI related to mental health. And what's the difference to this in your work? So really, I guess that question is, what's the unique selling point of Soul Machines?
Yeah, well, I mean, there's a number of companies in the world that have created digital characters, digital avatars. And there's sort of three ways to bring those digital characters to life. The first one is pre-recorded 3D video content. The second one's sort of motion capture, so human-powered capture. So the most common example of that is everyone sort of knows Lord of the Rings movies. So Gollum, Andy Serkis as the actor for that. He had a camera rigged up on him, and he was his motions and animation of himself transferred to Gollum, the digital character. And the third one is autonomous animation, which is what we do. So the core part of our technology is a biologically inspired digital brain. And that's what allows us to animate this digital avatar, digital character, the same way we as humans do. And where sort of Soul Machines is also going now is starting to get into the sort of body animation as well. So having a digital character animating their arms and hands and body as well, which brings in a sort of dimension of body language. And so that's where a lot of our research and development is focused, is continuing to evolve and progress that animation technology to ultimately make these digital characters as human-like as possible.
Yeah, I was going to ask about that actually. I think in the presentation, Greg Cross mentioned, he said, wouldn't machines be more useful if they were more like us? And the focus has been on that human side, the human face side. And yet, while I was doing it there, using gestures, we see the politicians do it all the time. And I know that's something you were working on. So really, what's next? What's next in terms of machines being more like us?
Yeah, good question. So I guess the first sort of part of it is the way we sort of approach making our digital people. We make digital twins, so a copy of a real human being, which we've done for in the entertainment industry. So we did it for a digital twin of will.i.am for a YouTube series called The Age of AI. And the other sort of side of it is, as we mentioned, we're sort of moving into that sort of space now of ultimately to have a sort of full body animated digital character. And as part of our sort of product now, is we do have gestures, so autonomous sort of gestures as part of the experience, including gazing experience. So you think when you're sort of talking to someone's eye contact and the way their eyes move is a hugely important part of that. Any interaction or any conversation, that is sort of part of our technology and product as well. So even sort of glancing in a digital experience, that sort of draws attention, brings that sort of whole sort of dimension into it as well. So that's where a lot of our research is focused. There's a big program at the moment for us increasing the diversity of our digital people. You know, it's a big world out there, and for us, we've come a long way from creating every digital avatar we made, considering that there's so lifelike and hyper realistic CGI. That used to be a huge amount of work to do that, months and months of work. We can do that in a pretty short time scale now. So what that is allowing us to do is to create more and more digital people that are representative of all the different cultures, ethnicities, looks of all the sort of people in the world. Because it sort of means that people can have, it empowers the users themselves to have a bit of choice as to who they want to speak to. Someone that's representative of them, someone they're comfortable, particularly in a healthcare space, someone they're comfortable talking to. That's hugely important. So that's where a lot of the sort of work is going in at the moment.
Okay, thank you. As many healthcare roles are human contact based, what roles can AI best help support?
Yeah, a very good question. And I think, so I think where the sort of technology is at now, there's obviously every health system in the world is just struggling with volume. And particularly there's a lot of early stage sort of triage or very sort of high level sort of questions that can be sort of looked after in these sort of digital experiences with a sort of digital person. And we sort of see digital people as augmenting existing digital people. So existing human people. So I referred to one of our projects for a children's hospital. So play specialists as an example. So they've got this sort of core knowledge and experience which isn't available all the time to all the sort of children, and that's just the challenges with being able to scale humans across in a big way. So leveraging that sort of experience and knowledge and putting that into a digital experience that is available 24/7. Those are the sort of roles where you can start democratizing that sort of that knowledge and support and have it available to more and more people. So if we think about sort of remote telehealth, telehealth's another sort of big space as well, where there is a sort of large knowledge base, a lot of IP around how we do that sort of telehealth support, building that into a sort of digital experience with digital people can help with the sort of scalability problems that some of those providers struggle with.
Okay, and what about legal implications of using AI in healthcare? For example, if the wrong information is given, so who's ultimately responsible, and how can you safeguard against those risks?
Yeah, and I mean that's a sort of ongoing challenge. I mean, even for doctors themselves today, that's always a challenge about potentially giving the wrong advice. And we find that not just in the healthcare industry, but also within financial services. Giving the wrong sort of financial advice in these heavily regulated environments. But I guess the benefit of using these sort of technologies is that within certain parameters, they're always going to sort of deliver what they've been taught. They're always going to sort of say it in the correct way, not miss out covering something or asking the right question. So we always approach any of these sort of, I guess in deploying AI, it's good to have a sort of few parameters around. If we think about digital people as an example, put some parameters around what role they're sort of looking after, and they keep within that sort of role. And where there's sort of questions or challenges and what the support they can provide, depending on the questions they get, it's ultimately being able to then put them in touch with the right people, and people don't sort of fall through the cracks in terms of the sort of healthcare support they can get.
Okay. Do digital humans learn from each other, or are they more like a collective?
There's a degree of, so within our technology ourselves, there's a lot of sort of learning we take from all the sort of interactions at an aggregate level. But certainly where AI is at the moment, there's a lot of the sort of front load work is building a knowledge base, an IP, whatever it sort of may be, putting that into the digital experience. And they do learn over time and become much more accurate in terms of understanding what users are looking for, what the intent of the user is. But yeah, learn from each other, probably not as yet.
Your presentation mentioned AI providing reduced significant barriers to access. So whilst some areas in New Zealand have limited healthcare available, they may also have limited connectivity. So what are the real connectivity issues that you see in New Zealand, and what level of connectivity is required for, I guess, even the most basic digital human?
Yeah, so I mean, and that is a sort of ongoing challenge. I mean, where the world has, and especially in the developing world, but also in New Zealand, connectivity's increased rapidly. More and more people are on mobile now. Mobile networks are expanding. We've got networks such as Elon Musk's Starlink, which is, I guess, sort of a game changer in terms of internet connectivity across the world. So that's changing at a rapid pace. And I guess we're sort of part of that sort of ecosystem, and for every healthcare organization to think about how we sort of resolve these sort of challenges. We're certainly part of being able to deliver these sort of remote sort of health experiences, but there is that sort of connectivity sort of side of it as well. Within our sort of platform, usually a sort of 3G connection at a minimum will allow you to have a sort of live interaction with your video with a digital person, but then you can certainly do it without a video and rely on sort of voice and text. That's a sort of slightly lower sort of connection.
Okay. Okay. Final question. How long does it take to train a useful digital human? Perhaps use Florence as an example.
Yeah, well,
or use another example, but that's quite a good specific topical one.
We can stand up a digital person very quickly, and a lot of the work is to, as you say, training. So we often think about them as it's part of a digital workforce. They start their role on day one. They don't really know what their sort of job is yet, so there's a bit of sort of learning and experience that needs to go into that. Generally, we sort of find about sort of 12 to 16 weeks to create the experience. For us, the animation and the digital person, that's all out of the box. That's all there. It's really sort of building that sort of knowledge base that they'll talk to. So yeah, about 12 weeks, we can have someone up and running in their role. And it's just the ongoing learning and development of that sort of role as well. So understanding what challenges the customers or the patients or the students might be having in those sort of conversations, and continuing to evolve it from there.
Okay. Yeah. Thanks very much for your time, James. Really look forward to the next iterations of Digital Human. Thanks very much.
No worries. Thanks, Andy. It's great to be here.
Fantastic.